gonna go ahead and come in now. Sarah, oh my God, no. No, Sarah, I thought you were doing so much better. Girl, why have you done this, Sarah? 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 Hello? Hello, yeah, I think my friend, she's not breathing. I'm afraid she might have overdosed. Please send somebody right away. I don't think she's breathing. I can't get her to wake up. Please help. Sarah?
What you got over here? What's going on?
Doesn't seem like she's breathing.
Looks like she's got a needle in her arm. I'm gonna go ahead and take this out, okay?
Okay.
Can you do anything for her?
Okay, you wanna move this out of the way? Let's get her to the ground, okay? Tell you what, you get her feet. Your hands. 1, 2, 3. Ma'am? Ma'am? She's unresponsive. She has a pulse, but she's not breathing. Grab that box, let's get ahead and start breathing for her. That other box too? Pulse. Okay, you want to take the breathing? Breathe once every 6 seconds. I'll do the assessment. Pinpoint pupils, diaphragmatic skin, bradycardic. Patient is apneic. All right.
Girl, hang in there.
We'll check her blood sugar real quick. Blood sugar's at 90. I'm going to prepare naloxone.
What's that?
This is a medication that should reverse the drug that she took. Do you know what exactly she took?
I think it was probably heroin. I've gone through some rehab and I thought she was doing a lot better, but so that's probably what it was. It's what she's taken before.
All right, we'll check the medication. Naloxone, 2 milligrams. It expires on May of 2017, so we're good there. All right. Okay. Stick this in her nose and spray. Okay, start breathing again. Keep breathing for her. Okay. Check her out. Don't see any trauma. Rest and breathe. Okay. Is there any resistance? Okay. Abdomen soft, non-distended. Pelvis is stable. No trauma in the legs. No trauma in the arms. Ma'am, wake up. Wake up.
She's breathing again.
Good, good. Okay. Just leave her just like that. Watch her breathing, and let's get her out of here. Okay.
Come in.
Hey Sarah.
Hi.
So I got your discharge paperwork here. I know we kind of went over some of this stuff earlier, but I just want to know, do you have any questions for me?
Yes. So actually I need some help. I need some instructions about how can I get rid of this addiction because I really need some help. I'm trying to get by myself, but I can't. So can you just help me out?
Sure. Yeah, that's really great to hear that. So you've actually got a lot of options. A common local option that we have here are methadone clinics. It's an outpatient facility. You go there and you're prescribed a drug called methadone. The drug actually works similar to heroin. It blocks the actual high that you feel without causing withdrawal symptoms. It takes away the withdrawal symptoms, but helps manage your pain. So you can eventually taper off the methadone and get off both of them altogether, both the methadone and heroin. There are a lot of other options too, and we do have caseworkers here that could definitely give you more information than I could about other rehab options.
Okay.
Does that sound okay if I
Yeah,
call
it does.
them?
Yes. Please.
All right,
Thank you.
I'll call them. Hi.
how are you?
Good.
All right, my name is Megan. You're Sarah, right?
Yes.
Okay.
And my name is Kimberly. We're both on the case management team, and we wanted to talk to you about some rehab options. And so,
I have some inpatient options for you. I have a few of them that I want for you to look at, but the one that I recommend is Hill. It's fairly close to us, and as well they have a great 12-step program for chemical dependency. During that program, you're going to also attend like NA and AA treatments. You'll go to those group therapies, okay? And with that, you'll also get a little bit of behavioral health therapy, okay? So we treat it as though it's a dual dependency type program over there. With them, you will be able to stay there short term. If you have any family members or whatever, then they can actually, help with your treatment options as well as your discharge plan. Okay.
Okay.
and the second option would be outpatient. The facility that I have in mind is Southlight Healthcare, and they have like an opioid treatment program, so it's specific to heroin abuse and what have you, or addiction. And so they'll probably use medication assisted treatment, meaning you get a chance to kind of detox by using the different types of medication that helps with that, like methadone. And so with that being said, they also have like a holistic approach, so you get a chance to have counseling and behavioral therapy along with that. And another, I guess, plus would be that you don't have to worry about missing work. Like you could live home and you could go to work and just kind of maintain or try and get back to your normal life. And you can also have it. You also have Medicaid, so
That's
there's
wonderful.
Medicaid there.
And Holly Hill, they offer, they accept Medicaid as well as TRICARE, most major insurance plans too. So, you can, between the two program options, you can look at them and review it. And maybe
Can I have
make
the
a-
information?
Yes, we're gonna get those to you.
I will read it and think about it.
Okay.
All right.
All right, and maybe,
Thank
between
you.
you and your family, just make a decision.
Well, I'll
And-
do it.
Okay.
Thank you.
All
And
right.
you can contact us if you have any questions.
All right. Thank you.
Thank
All right,
you.
You're
All
welcome.
right, take care.
You too.
Come in.
Hey girl.
Hi.
How are you doing?
Thank you.
Oh my gosh, you scared me so much. Please don't ever do that again.
Oh,
Oh
well,
my god, how are you
okay.
doing now?
I'm doing better.
Good.
But
good.
it's just worried because everybody now knows that I'm using it, that I'm addicted, and I'm gonna lose my job. I don't know what to do now.
Oh, it'll be okay. You know what? I went through rehab, so I've been there, and I was able to keep my job while I went through rehab, because I was really surprised to find out a few laws that your employer has to follow if you want to get clean. So you have to get clean. You have to quit using the drugs. But if you tell your boss about it, he has to keep it a secret. So don't worry about everybody else at work finding out about it, because he's got to keep his mouth shut. But there's this thing called the American with Disabilities Act, and they can't discriminate against you if you're staying clean. Now they can still drug test you, so you gotta be committed.
I will do it.
All right.
All right.
And then they had to give me time off of work through this thing called family medical leave, and so I got to take like 2 months off of work so I could go to rehab.
Oh.
And then when I went back, they had to work with me and give me some time off, like just during the day every now and then. I still had to do my job and make up my time. But if I had rehab appointments or counseling or treatments, they had to work with me so that I could go to that during the day.
That is wonderful news. Thank you.
You're welcome. We're gonna get through this, all right?